Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about black toenails. A lot of times we'll have people come into the office and they'll actually have a black toenail. So let me talk to you about black toenails using those four questions. Number one, what is it? There are really two common reasons why you could have a toenail that is black. One of the options would be melanoma, where you get a melanoma underneath the toenail. This is rare, although it should be something that should be on your mind if it's an area that has been progressing over time and it's changing and the coloring is changing and so forth, and it can be treated if that were the case. The second, the most common and the usual reason is called a Subangle hematoma, or a hematoma or bleeding underneath the toenail. This is very common. If you damage the toenail or you injure the toenail, when you start to bleed underneath, it'll actually start to look really black, and it will usually progress really quickly and really appear without a whole lot of warning. Number two, why does it happen? Melanoma is basically skin cancer, so it could happen the same way any melanomas anywhere else does. Commonly, it'll be in individuals that have sunburned or constantly tanning their feet or those kind of things, and they're getting injury, sun injury to the nails, just like they are the rest of the skin. And toes, the Subangle hematoma we kind of talked about already. It's injury, some kind of injury that causes you to bleed underneath the toenail. The Subangle hematoma, as long as you don't have neuropathy or loss of feeling in the foot, you can have a pretty significant discomfort, pretty significant pain in the area, and usually requires treatment. What can you do for it at home? If you have a Subangle hematoma, really, if it's not hurting, you don't necessarily need to do anything, and over time you'll end up cutting off the blackened portion as the nail grows out. If it's causing pretty significant pain, the easiest is to puncture the nail, to use a needle of some sort and puncture that nail and allow the pressure to come out. Melanoma should be seen by a doctor. Number four, when should you see the doctor? Melanoma, like I said, immediately. If you suspect that it may be melanoma, you should be seen by a doctor, and it should be evaluated and biopsied and make sure that that's not what it is, or if it is, so they can get treatment. If it's a Subangle hematoma and you need help, for example, draining it, going and seeing the doctor is the option for that. Or if you're not sure which of the two it is, you can also go see a doctor and get it evaluated. This is Dr. Brandt Gibson. This is your podiatry tips